Welcome back, everybody. I hope you enjoyed your lunch and had time to reconnect with colleagues and interact with the poster presentations. Before we begin, a quick reminder that at the end of each session, there will be a panel discussion and opportunity for questions. In-person attendees can submit their questions using Slido or walking up to the microphones. We encourage both in-person and live-streamed audience to ask questions using Slido. And a reminder that the QR code is on your program, or you can go to slido.com and enter #IMSForum2023. Please post your questions during the presentation and upvote questions you would like to have answered. I would now like to introduce the next session on best practices, creating a positive vaccination experience with CARD, how to play your best hand with Anna Taddio, followed by commentary and feedback from the field with Annie Lau.
Thank you. Can everyone hear me okay? Yeah, perfect. So thank you for coming, and thank you for inviting me to speak. It's a pleasure as well as a privilege to be here. And I, like you, haven't been out much during the pandemic. I think this is the second conference that I've been at, so it's really great to see you in person, and it's really great to reconnect with people from BC-CDC, who I have always considered leaders in immunization, and just shows me today with the quality of the work that you're doing, how engaged everyone is, that you still are the leaders, you continue to be the leaders across Canada. I also want to take this opportunity to thank you for everything that you've done during the pandemic. I know everybody's worked hard, and if you looked at the program, you might have noticed I don't really look like the picture that's there, and that's because I was afraid to give the organizers an updated picture because I was worried about what happened to Lisa Laflamme and that they might actually pull the invitation. I was telling Manish, it's like, shh, don't tell anybody I have gray hair. No, the truth is, the pandemic did this to me, right? So maybe it did that to you too. But I'm going to try to keep on time, and I hope that you actually interrupt me if you have questions. How many of you have witnessed people, show me with your hands, who are really distressed during vaccination? Can we turn down the volume a bit on my mic, Michael? I don't want to be echoing. Yes? How many of you have seen people faint? Refuse vaccination because they were afraid. Yeah? So all of us have seen this. So even if we're not immunizers, we're caregivers, we're friends, support people, we're others in the room, onlookers, and we have been witnessing some of these adverse reactions. And what I want to talk about today, which I think some of the themes have come out in this morning's sessions, is about how we can actually begin to change this. So we can make it better. We can make vaccinations safer to administer by reducing these side effects, and we can make it a better experience for everyone. And that's what the presentation today is about. Before I begin, I want to acknowledge funding for this work that comes primarily from the Canadian Institutes of Health Research, but also during the pandemic, a lot from the Public Health Agency of Canada. So I'm grateful to them for supporting us and for allowing us to do some more work in this area. So what I want to do over the next half hour or so is first just talk to you about why treating pain and associated symptoms like fear, dizziness, this sort of stuff. Why is this important? But I'm guessing that most of you already know why it's important. And then quickly talk about what the evidence base is. What is some of the stuff we could be doing to make it better? And then how do we get that evidence into practice? So there's always great guidelines that tell us what we should be doing, but they fall short. And the guideline that we created is no different here, with helping people to really understand how we get this stuff into practice. There's a lot of, you must do this, you should do this, but not so much about the how. And vaccination delivery, as all of you know, is very complex, involves many players. And there isn't a single person that can control everything and make it better. And we can be undermined and our efforts can go nowhere if we're not supported. So I'm going to talk about a framework for vaccine delivery that helps us all to get to be in a better place. So first, let's talk about pain and why it's important. So generally, I want to start with the World Health Organization's definition for vaccine hesitancy. We all heard about vaccine hesitancy. Probably all of you heard about it in 2019 when the WHO first introduced vaccine hesitancy as a concern, as one of the main global threats to health. And then it's only a year later, the pandemic happened. And then shortly after that, we had vaccines to help. And we started to see how some people were not accepting the vaccines. So vaccine hesitancy became alive in a very serious and concerning way. Now, the World Health Organization actually defines vaccine hesitancy as a delay in acceptance or refusal of vaccinations despite their availability. We all know complex, context-specific, varies across time, place, and vaccine. Importantly, though, it's influenced by three major factors: confidence, convenience, and complacency. And I'm going to come back to those thoughts. Okay, a little bit more about needle pain specifically. We use needles in healthcare ubiquitously for everything. We prevent problems, we diagnose problems, we treat problems, we monitor problems. Vaccinations is the most common way people are exposed to needles, and we're preventing problems, right? So everyone has experience with vaccinations. Interesting, pain from injection is the most common adverse event following immunization, even though we don't acknowledge it as such. The way someone experiences pain from vaccination is subjective. That is, it's an individual experience, and we don't know how it feels for somebody else. Children in particular are more vulnerable to the effects of pain. This is because they report more pain compared to adults, and they're also more bothered by pain. Interesting fun fact, 2/3 of kids are afraid of needles. So it shouldn't surprise us when we have kids that we're vaccinating that they're afraid. That's quite normal. But look at this, 1/4 of adults are afraid too. How are they afraid? Can anybody tell me? Why are they afraid? Or when did they acquire this fear? Maybe is a better question. When they were kids. So a lot of the kids who are afraid grow up to be adults that are afraid. Some people grow out of their needle fear, but some people don't. And if we don't address this, they can continue to have that needle fear into adulthood, and they do. Oh, sorry, I went forward. But if you have a fear of needles, what this can do is actually make your vaccination experience worse, because it can make your pain be worse. So there's a reciprocal relationship between pain and fear where one fuels the other. So if you have more fear, you experience more pain. If you have more pain, you experience more fear. And these aren't the only two symptoms that you can have that we call immunization stress-related responses. You can also have other responses like dizziness, headache, nausea, and at the extreme, fainting. What happens is if people experience these side effects during vaccination, it can lead them to have negative attitudes about vaccination, right? So the last time they remember getting a vaccine wasn't a positive experience. They carry that negative attitude into the future, and it might affect their willingness to be vaccinated. And right now, across the lifespan, we actually estimate that about 1 in 10 people delays or avoids vaccination because of concerns about pain or fear. It doesn't sound like a lot, but it is when we're trying to vaccinate everybody, which we were trying to do during the pandemic, which we're trying to do, we heard about with MMR, right? We want close to 100% of people vaccinated. So even 5 or 10% of people not getting vaccinated is really a lot of people. And I would say that this is one of the reasons to not get vaccinated, where we actually do have some solutions. We can help. We can make a difference. So I want to pause for a second, get you to consider this statement. People's experiences of pain from a needle injection are the same because the pain stimulus is the same. How many people think this is true? Good, nobody thinks it's true. And we all know this, right? And I said this, it's a subjective experience. Pain and fear are subjective. We all feel it differently. But sometimes we actually impose how much pain or fear we think people should have in the context of giving vaccinations. We kind of forget, right? So when people get afraid, we're like, really? You know, it's not a big deal, or it's going to be over in a second. So we have to kind of stop ourselves and think it's really what the patient is saying that it is, and we need to respect that and support that individual. So just to bring that to you, it's a complex experience, involves not just biological stimulation, nerve conduction, but also psychological and social factors. And I'll come back to that too. So what can we do about it? I just said it was a problem, but I said there were solutions. And in 2015, we published a clinical practice guideline where we summarized the world evidence and we made recommendations about what we can do to help with pain and related immunization stress-related responses like dizziness and fainting and fear. And this slide summarizes our recommendations. Along the bottom, you see 5 different domains or categories of pain management. We call the 5 Ps of pain management. And I just want to go through some of the evidence based in those different categories. I apologize for moving. I can't help it. I'm Italian and something has to move, whether it's hands, mouth, whatever. So anyway, if we go from left to right, I'll do my best to stay still. But the first category is procedural interventions. This has to do with the operator, the technique, how we deliver vaccinations. So interventions that are effective to reduce pain are things like not aspirating, injecting quickly, and when I say quickly, I mean less than 2 seconds, not traditional 5 to 10 seconds, which a lot of us were trained to do. And then other things like if there's multiple vaccines to be given in a single appointment, to start with the least painful one, not the most painful one, which is kind of counterintuitive. So start with the least painful one and end with the most painful one. Next category is physical interventions. So this has to do with body position and activity. And what you see here is a picture of somebody sitting up. So we recommend that as soon as people can sit up, so even infants, they should be held upright, not lying supine. We tend to be more nervous when we're lying supine. We feel less in control, and that's true across the ages, from children to adults. Next category, pharmacologic interventions. This has to do with drugs or medicines that we use. We don't really have a lot we can offer, but across the lifespan, we have topical anesthetics that work in all ages. So using topical anesthetics would be good. Next category is psychological interventions. This has to do with thoughts and behaviors. And in the picture, you can see somebody doing deep breathing exercise, which can be calming. Other things that might fit in this category are things like distraction, for example. And then finally, at the end, I have something called process interventions. This is basically about how we get everybody to do the first 4 things. Okay? So who needs to know about this, and how can they all work together to make this happen? In our guideline, like with other guidelines, we provided some treatment algorithms, point-of-care tools, things that we thought would be helpful to get people to know how to use this evidence base. So here's an example of one of the algorithms that's in the guideline. You see a timeline from left to right, time away from vaccination up until the time of vaccination, and then where these 5 Ps fit in. So you can find procedural strategies, for example, right at the time of injection that someone would deploy. Other things have different timelines, and you could look to see what that is. We separated, just so you know why we have infants here, we separated out the infant interventions because they're quite different, involving breastfeeding or giving sugar water to babies. And then we also had another category of strategies we recommend for people who have high needle fear, who can't engage in the vaccination process because they're simply too afraid. And for these individuals, there's a treatment called exposure therapy that's usually guided by a mental health expert, and they would get this therapy before then they could participate in the vaccination process. So we had stuff like this to try to help people. Now let me spend a couple more minutes before I move on to talk about fear and pain a little bit more. I want you to pay attention to the patient in the middle of this graphic and see on the right, we have that reciprocal relationship between pain and fear being highlighted. And so what I want to show you is that patient's experience is not their own experience, but it's influenced by many factors, including who's there. So if you look at the blue rectangle, you can see the other players that are there, caregivers, onlookers, clinicians. These are all people who can be helping that individual to cope or increasing their distress, promoting distress or promoting coping. And if you look across the left and along the top of this diagram, you'll see where the 5 Ps, our recommendations, fit in. So some of the interventions are directed to everyone. Like I said, the process interventions affects everybody. It's about education and preparation. Procedural interventions affect the clinicians. And then along the top, directed to the patient, are physical, pharmacological, psychological interventions. So this is where the patient decides. The patient has choice about what they want. So another part of the graph I want to show you is the right side, which is lighter in color, to show you that actually we should be thinking of that vaccination along a timeline or a continuum. As I said, people undergo needle procedures repeatedly. Vaccination is the most common one that we undergo repeatedly. So it's possible that how you experience vaccination at one point in time is going to affect how you experience vaccination in the future, right? So if you had more fear, you had more pain, you may carry this into the future. It'll feed your pain, it'll feed your fear further, and then you could end up with a situation where you become a parent, and then you promote these attitudes to the next generation, to your kids. So you have another generation of individuals who's afraid or has negative attitudes about vaccination because the experiences of their caregivers have been negative. And then the final thing to show you is individuals with a high needle fear. They're at the bottom here. There's no single predictive trait or event that's going to lead someone to have high needle fear. But if they do, we definitely would want it addressed so that they, again, can participate. And they don't need to have this as a barrier when otherwise they really would want to be vaccinated. We made some other recommendations in our guideline that, quite frankly, people didn't really pay attention to. But some of these things came out during the pandemic, and fortunately, people started to change how they did things. But these are really important. They're about trying to create an atmosphere that respects individuals, gets them to participate in their care, and supports them. It's also looking at anxiety more generally and thinking about what is it about how we deliver vaccinations that can cause fear to increase, and how can we try to minimize that? So we don't often pay attention to environmental things that we do. Again, some of this came out in the pandemic, and we learned and we kind of adapted when people would say, we don't like the way this is being done. We don't like that we don't have private spaces, for example. So we made adaptations. But sometimes we don't really look at this from the point of view of a patient and what they're experiencing. So we made recommendations to reduce fear cues, for example, auditory and visual. So people shouldn't see things that make them afraid. They shouldn't hear things that make them afraid. We said minimize waiting times, especially if somebody's standing. You're not uncomfortable if you're waiting. You start to get nervous. You get nervous. And if you were nervous about the vaccination, it gives you an opportunity to get more nervous about the vaccination, right? Which increases your risk for stress-related responses. We have provide privacy and comfort, again, respecting the individual and how they want to be treated. And then finally, being observant and responsive. So really inviting that person to participate in the process and then catering or at least supporting their coping choices. Now, after we published the guideline, we wanted to see if it was being used. So Immunize Canada, as part of their work, did an environmental scan and gave us this beautiful picture of Canada that looks like the flag, and it's actually showing you that 11 out of the 13 provinces and territories actually embedded recommendations from the guideline in their vaccination programs, in their policies, procedures, so it looks really great, and it is great. But then we said, well, let's see actually what's going on kind of closer to where vaccinations are happening. Let's talk to the patients who are getting vaccinations. Let's talk to public health units about what they're doing. So healthcare providers who are delivering the services and patients who are receiving the services. And in this particular project, we focused on school-based vaccinations. So on the left side, you can see the results of a survey we conducted with students across the country about their experiences with getting vaccinations at school. Just to point out the main results, 59% of kids said that fear was the worst part of vaccination, 35% said pain, 50% said they knew what to do to help control their pain or fear, and 17% said they were prepared ahead of time. If we look on the right, we happen to survey just public health units in Ontario, of which there's 34 of them. So of the ones who participated, 58% said they had policies on pain and fear, 74% had a formal training program, 50% educated their staff about pain and fear management, 30% incorporated students' coping choices in vaccination delivery, and none of them recorded pain or fear. The majority, however, did record fainting. So it shows that kind of not all these ideas from the guidelines are actually being operationalized. So there are opportunities for us to intervene. There are opportunities to work on the process part, getting people to know, being prepared ahead of time, and then actually addressing the concerns of the people who are getting vaccinated. And in this case, it's kids. And for kids, the majority of them, their primary concern is they're afraid, right? So what are we doing to help them with their fear, to teach them how to cope with pain and fear? And this is where CARD comes in. So we realized that we needed to do some more work. We needed to understand how we could help units, systems, integrate the research evidence more systematically in how we deliver vaccinations. So vaccination delivery is complex. As I said, no single person owns it, but how can we get everyone to know what they need to know and then work together more collaboratively? And we came up with a framework called CARD, very intuitive, user-friendly, basically rebrands the 5 Ps of pain management. And if you know what all these letters stand for, you're already knowing what much of the evidence is. You don't even need to memorize the lists. C stands for comfort, A stands for ask questions, R stands for relax, and D stands for distract. So if you think I'm setting up a clinic, how can I do some of these things? You might have ideas. How can I make this space more comfortable for people? Can I make it look inviting? Can I put some posters on the wall? Can I take away some of the clutter? Can I have some chairs for people to be able to sit? Make it a comfortable space. That's what comfort is about. How does the patient play their cards in terms of comfort? Well, if they were kids, we would tell them, do you want to wear your pajamas? Something comfortable that you can get vaccinated in? How about a short sleeve shirt so it's easy for you to get your vaccine? So different people can have different choices about what they do to help together make this a better experience. A, ask questions. Well, all of us are nervous when we don't have the answers to questions and concerns. Ask, the ask card, invites people to ask their questions. So if it's a kid, they might ask, how much is it going to hurt? What are you going to do to help me with the pain? Adults may have other questions, or others may have other questions about vaccination. So here we're actively asking people to participate and to let us know about their concerns. R is relax. How can we reduce the fear cues? What can we do to make it a safer environment for people? Can we close the door? Can we provide privacy, private spaces? What else can we do? Can we hide the needles? You'd be surprised how many needles are lying around all over tables if you look. And if you look right at also what's on the media, what they're reporting, lots of needles, lots of injections that's potentially scaring individuals from getting vaccinated. So how can we change that up? And for individuals, what can they do to calm themselves down? So I showed you a picture of a person doing deep breathing. What else might people be empowered to do to help themselves calm down if they feel that they're getting nervous? And you'd be surprised, a lot of people don't really know how to calm themselves down. A lot of people don't really know what deep belly breaths really means. They think taking a deep breath right before the injection is deep belly breathing, and it's not, right? So how can we teach people this, empower them? And then finally, D is for distract. Well, some of us want to be distracted during procedures because if we pay attention, we get more scared. But guess what? Not everybody wants to be distracted. Some of us actually cope better when we're paying attention to what's going on. And if we don't know what's going on, we actually imagine things that are much worse than what's happening. So again, this is about knowing what you can do to provide the option for people to be distracted, but not impose the same coping strategies on everyone, because we're not all the same and it doesn't work the same, right? And some of you are nodding and you probably have that experience. So I said I'd come back to this, just to say that CARD actually addresses all the domains of vaccine hesitancy, and some more than others. But it addresses confidence because we're making vaccine delivery safer. We're reducing a side effect of vaccination, pain and associated symptoms. We're making it safer. We're also, because we're making a more positive experience, creating more positive experiences with healthcare providers, which is building trust, right? So people don't think, I had a bad experience and it's in the context of being with a healthcare provider, therefore you associate the healthcare provider with something negative. Now you have something positive to remember them by, not negative. They tried to help me, they tried to make me feel comfortable. I appreciate that. How about convenience? Well, we do make it easy, and we have been making it easier and easier for people to get vaccinated, but we don't do everything that we can do. And again, coming back to the pandemic, we did change some things about mass vaccination clinics where we could accommodate some more of the strategies that people wanted us to use. Thank you. I'm running out of time and I'm not done. Okay, so things like privacy, having a support person, stuff like this, it matters to people and may prevent them from getting vaccinated. And then finally, complacency is about addressing people's perceptions of vaccination, about the disease. And if we get people to ask questions, then we can address those issues. So to extend on this point, we don't pay a lot of attention to what it takes to build trusting relationships with individuals. It's not just about competence, showing them that we know everything about the vaccine. It's also showing them that we care about them. And it's when we have both that we build trusting relationships. And also by inviting people to be part of their care, to be active participants, to listen to them, we're showing respect, we're actually helping to operationalize patient-centered care, which is what we espouse to be doing all across the country. So everywhere that we've tested CARD and implemented it, we've shown improvements in attitudes, knowledge, safety of vaccine delivery, and experiences are more positive, not just for the patients, but also the providers. And here I have, as a resource, if people are interested, I'm happy to share the slides, results from different studies that we've done before the pandemic and after, just to say that we've tested CARD across all ages from 5 and up and demonstrated it to be effective, including also different areas. So this is schools, public health, mass immunization clinics, and as well in pharmacies. So just to help people to know what they can do, we created something called a 4E model. If you think of these 4 different letter categories, you can have ideas about what you might do in each of those to do CARD. So I mentioned this stuff already, educating people. You don't even have to do this ahead of time. We literally have transformed pharmacies within 15 minutes, before CARD, after CARD. So you can educate people on the spot. Environment, make some changes, move some furniture around, close the doors, hide the needles, simple stuff, make a big difference. Then invite participation. I'm going to show you a CARD checklist where we give people options. When they check in, we say, listen, we want to make this a great experience for you. Tell us how we can do that. Let them guide you instead of you deciding who you want to offer what to, guessing what this person might prefer. This totally streamlines the interaction and shows people right up front we care about them and their experience. And then evaluation. So I said we weren't really doing this systematically. We don't do it systematically. We obviously do it as part of our research projects, and we do it right after vaccination when people have a waiting period. So we give them surveys. We ask them to tell us what they think, and that's how we get ideas for how we can make things better. So I have an infographic that was originally made for pharmacies to help them to understand CARD, because CARD is new to pharmacies. They're new as vaccinators in general. And here we have ideas, just so you know, across the bottom about what it means to insert CARD here or there in the different parts of the process. And the end here, I just want to highlight some resources that might be helpful for you if you're interested to know more. We have resources for providers, including e-modules now that we're using to train pharmacy students and pharmacy technician students across the country on the Canadian Public Health Association website here on the right. We have tools for kids. We have a card game so kids can learn about how to cope before they come to vaccination, and they can use the game as a distraction item. So I'm wondering, Kathy, if you want me to show the little clip or leave it of the child playing the card game? Do people want to see or not see? Yeah. Kids learn real skills. That's what I want you to see. Okay, it's not like dumbed down for kids. So let's play it, Michael, quickly. Thanks.
Would that help you too? Sometimes I want to be in a private space where less people can see me. It makes me feel better. A private space might help you feel more relaxed. What do you think? Something that helps
Child
me
nodding.
is to breathe deeply. Let's try it together. I have a game to help you practice. Press the screen and breathe in. Remember to breathe for 3 seconds. Let go and breathe out for 3 seconds. Breathe in for 3 seconds. Now breathe out for 3 seconds. Now breathe in. Breathe in for 3 seconds.
Right? So if we stop it, Michael, we'll try to finish off here. Here's the card checklist, just to say that this is sort of the golden tool to engage and have people be educated and participate. We change up the options depending on where we are and what we can offer. So some places, for example, we might be able to offer topical anesthetics, and that'll be an option. If we can't do that, that's not an option. So really cool to have something like that. Here's just some before and after pictures. I won't say much, just to show you that we could transform spaces. We don't need to make big renovations or anything, just put up some posters. This is a pharmacy. The left is what it used to look like. The right is how we prepared it for kids' vaccinations during COVID. Bright posters, signage, so it's clear where to check in, and a card activity cart, where kids could be free to take something, have something to do while they're waiting, so they don't get scared. Very, very, very helpful. Here, another one, other rooms, changing how we orient the furniture so people aren't afraid, so they're facing things that are interesting. And then just I don't know why it's skipping. So now we have, just to show you up close, what's on the activity cart, things like coloring pages, very inexpensive items, mazes, pipe cleaners that people can play with. And as I said, topical anesthetics, if we can include them in the practice, we do. We have tools that can help people to know how to engage in conversation. So what kinds of things do we do that make people more afraid? What words? So for instance, if we're nervous, we transmit that nervous energy to others. So trying to stay calm, trying to be positive, even when things are hard, finding some nugget of something good to say to make people feel more confident, and then using words that also are not alarming. So I know we use the word shot a lot, but it's something we definitely try to stay away from because it conjures a very negative image, makes people afraid. So use more neutral language. We have surveys for individuals. These are all available on our website, so you can get them. And I wanted to end really, I think this is the most important thing, to show you what CARD looks like in an interaction between a healthcare provider and a child. Can you play this, please, Michael?
Some kids get really nervous with vaccines, and some kids aren't nervous at all. Let's say we had a scale of 0 to 3. 0 is going to be the lowest. Where would you say you are on that scale? So that's pretty high. So you remember the card system that Kelly just went over with you as well. What kind of card are you going to play today that's going to help you with that?
Relax and distract.
Nice. What kind of things are you going to do to relax?
Deep breathing.
Right. Can you show me how you do that? Perfect. And what about distraction? Squishy. And I see you've brought a buddy with you too.
If the student brings a friend, ask the friend how they're going to help.
So you know what else can really help? If your buddy blows bubbles. Do you like bubbles? Bubbles can be fun. So I'm going to have your buddy. What's your buddy's name?
Brooke.
Brooke. Hi, Brooke. Do you think you can blow some bubbles while I get things ready here? Deep breath. Blow. You're doing extremely well. One more, honey, and then you're done. Good job. You're completely done. What do you think? You did really, really well. And thanks, Brooke, for helping out.
Okay. And the last slide is just to say, in summary, pain is part of immunization. We can do something about it. We can let it not undermine immunization by embedding what we know from research evidence into practice. You see, it's not rocket science. It's really easy. It's just about doing things a little bit differently. So I hope that there's some nugget of information in here that you might be able to take into your practice and make it a better experience. And I'm so sorry I went a little bit over. Thank you.
Well, thank you so much, Dr. Taddio. What an incredible presentation, and the framework you presented and the resources you just provided me, and I'm sure all the audience agree, is that so much to think about, so much to chew on, so much to digest. Thank you so much. And so at Children's Hospital, Family Immunization Clinic, where I'm currently working, we have countless scenario and experiences with patients dealing with pain and anxieties and needle phobia. So today I'm limited by time, so I'm just going to share with you two stories. But before I jump into that, I know that pain is such a subjective experience. What works for that person at this time will not work the same the next time. So for all of us, I think last 2 years plus, I think all of us have been impacted by immunization and needle phobia and dealing with all those, not only our patients or receiving our injections, but also ourselves getting jabbed or giving it again, mass clinic, there's no privacy, all those things, it just and on. So I always tell my clinician and team, which are we're a small team, Anna Hong and Aliyah Sheriff, who are not able to attend to the forum today because they're manning the fort. But you know what? If you are successful or not successful giving the shot, it's no reflection of you. Okay, and I really appreciate what Dr. Taddio is saying, reinforcing the issue of trust. I think through this morning, all the speakers, indigenous community and the elder and everything, I think the word came up in my mind is the trust. Is so important. And it came through Dr. Taddio's presentation as well, the trust. And in nursing, I don't know about you, my first lab was communication skills. The challenge is, in less than 2 minutes, you have to build a trusting relationship with your patient who's a stranger to you and you to him or her, and build a rapport so that they could tell you all the secrets and details of the Medicaid, situation, maybe STI, whatever, but so that you can be equipped to be an effective helper for their medical challenges. So translate that to immunization. We don't have a lot of time. We love to have a science class and everything else and follow A to Z, Dr. Taddio, right? But reality, how does that translate? So there's two stories. Well, I had a chance to help the mass clinic for COVID-19. I was really getting my public health tingle and itch, so I went to help. And this young man came down and sat by my station, and that's great. And he was, both arms are completely tattooed. I go, nice and strong, beautiful. And so he said to me, very quietly, he goes, I'm afraid of needles. Think about that. So for the next few minutes, I said to him, make him comfortable, ask questions, comfortable, relaxing, build rapport, less than 2 minutes. I go, tell me about it. How long did it take for that whole arm to be completely tattooed? And did it hurt? He just started laughing. We just had a great chat, about their pain experience. He goes, of course, it took days to complete. And of course it hurt. And I go, how does that pain related to half a second? Informally, Dr. Manish, I'm kind of got the label of the title of fastest needle in the West. So I go, if you give me less than half a second, I'm done. And we just chatted again. We're just having a great time. And then with his partner holding his hand, having all his worry talked and building rapport, that first lab, he successfully got his shot and walked out of there, and we just applaud him. So what's the difference between the two painful experiences? Days with tattoo and pain, just my half a second. So moving on to my next story. A few months ago, I had a chance of meeting this 13-year-old patient that came to my clinic at Children's Hospital. And the referral diagnosis or concern is needle phobia. Again, I don't have the luxury of meeting her before or anything. So again, my lab many years ago, gotta build a rapport, build that trust. So I greeted her and her parents or accompanying legal guardian, and I reinforced, Dr. Taddio, you'll be proud of me. You know yourself, I'm gonna follow your lead. You know what makes you comfortable, relax, distract, whatever. I am gonna follow you. And in fact, I literally did, because she hardly said anything to me. She walked straight into my clinic, sat herself down in the clinic room, in the chair, rightful chair actually, the chair. And then to my surprise, I go, wow, she's really taking the lead. I'm going to follow. So the next thing is that she grabbed the piece of paper, a worksheet. Okay, I'm going to try. That many of you are familiar. It's an outline of a human body. It's a worksheet that we have developed for our clinic because to jot down things that we don't want to forget, like the lot number or which limb got the shot, things like that, right? Just a worksheet. And then I thought, okay, that worksheet is about her, has her identifier sticker, has her name, has her birthday, it's hers, no problem. She wants it, great. I go, maybe I did build a good rapport. But before I finished my thought, she grabbed the pen in my hand. I go, what? Now you're really crossing into my personal space. And then I thought to myself, no, Annie, you really build a comfortable rapport with her. She really feel comfortable with you. I go, grab some more, right? But I did, because she was still quiet, she just sat there next few minutes. As I watched, she just started drawing. And I looked at her, and in that moment, probably about, 2 minutes or so, I just felt there is this galaxy lined up. It was focused on her. She was so focused. She was doodling, and I just like, hey, I'm going to watch. You took my pen and paper. I'm going to see how it goes. And the next few minutes, she added details to this silhouette that's kind of blank and naked, and added amazing details to this. Now, if all of you, I'm so glad for you really blew it, it's really great. Look at all the details. She added extension eyelashes, which I envy. She added a beautiful flowing veil with wind, okay? She added a cape behind her. She added, if you see closely, she really added a very pose, okay? I cannot move back, from this to this. After that, she gave back the pen, and she gave me the drawing. And I said, thank you. And she said, I'm ready. When they said that, you better grab that moment, right? You all know that moment. So I just, and she got her vaccines. And we just applauded. And we just go. And she was just so happy, grin ear to ear. Wow. In that moment, she transformed that blank. As I reflect, that's where she found comfort, relaxation, distraction, herself. In that moment, to draw, to transform that blank person to something that is so meaningful to her. That's her. She mustered all her energy, her courage, every cell fiber in her body to overcome the anxiety, fears, whatever she's dealing with, and got to a place where I'm ready. I was so impressed, so blown away. And I thought, wow, she really was a superhero. She saved herself. Well, actually, she defeated all her anxieties and fears. She saved herself, and she saved the world, right? And I think all of us can be superhero ourselves. I mean, we're immunizers, yeah, but we also receive too, right? We have guidelines too, we need to be immunized as well. And we can help support our patients to become superheroes. But the trick is to find that card or key that unlocks the world of courage, to unlock the world of strength and possibilities. Thank you.
Thank you both. Very interesting, innovative, and very important information for us to take away. I've just been told that we may be deferring the break. So do we have a few minutes for questions? Yes? Okay, great. I don't see anybody in the room, so could we go to the Slido team for a question, please?
Yes, for sure. So as time is of the essence, can you comment on how much extra time it takes during a visit to implement some of these strategies?
Great question. I guess I'll start and you can,
Have your
carry on.
microphone.
So we found that CARD is actually time neutral once it's embedded in the system. So you need to teach people, so the healthcare providers for sure, and set stuff up. But pretty much after that, once you embed it in your process, it's good. And in fact, you can save time during the interaction during vaccination. So that's what, if there's any time impact that's good, it's during the vaccination process when people are most anxious. And that's because you have this CARD checklist, you already have an idea about what this person wants, so you're streamlining your interaction with them. We also, in some contexts, removed the alcohol swab, which, as you know, is not an important or evidence-based part of vaccination delivery, so we took it away. And that makes a big difference too. That's an extra minute that you save, and then people who are anxious, like kids, makes a big difference as well to their interaction. So didn't add time, and I'll tell you how. In the school setting, where public health was already going in, dropping off consents, or maybe having a lesson or time with students, CARD was part of that. So CARD became part of the, we need to make a vaccine appointment to come and visit your school, but we're gonna talk to the principal about everything we need and how we're gonna make this happen and what we're gonna do exactly. So a bit of investment to teach the principal. Well, once you teach the principal knows. One-time investment. Then teaching the kids. If there was an opportunity, like I said, if public health already talked to the kids, then we would add CARD information. After all, that's what they're really concerned about. So let's give them the information they need to help them to prepare for the procedure. In pharmacy settings where we didn't educate people ahead of time, we would educate them when they walked in the door. So they got the CARD checklist as soon as they checked in. When they filled in their consents, we oriented them to CARD. We said, tell us what you want us to do. And we could do it then. So we can really find ways, depending on what was already happening, to integrate CARD. Obviously, if you can teach people about it ahead of time, it's probably better, but you can still have a big impact just with teaching people at the time they come in the clinic. And I'll tell you, this helped during the pandemic as well. So where mass immunization clinics were happening and people weren't the most anxious people who were coming for those vaccinations, like to be able to show up at a mass clinic, we still saw a benefit of CARD, reduction in fear in individuals of all ages. So you can see how you might work it into your system, but if you're doing it and you've got it as part of your process, it might save you time.
Great, thank you. And do we have time for one more? Okay, I'm getting the nod. Could we have one more question, please, from the Slido?
Yes, for sure. So if best practice is not to pre-draw vaccine prior to seeing patients, but we notice when patients witness drawing up, this can induce fear. Do you think there's merit to reconsidering best practice related to pre-drawing to reduce fear?
Mm-hmm. So in our context, vaccines got drawn up in different settings at different times, usually shortly before. So if it's a mass clinic, a few were drawn up at a time and delivered to the vaccinators. We would just cover them up in boxes. So we would make sure that they are not in view. If people were drawing up vaccinations while the patient was there, because that's the practice of the organization, we really just put little barriers, ways for people not to see what the nurse was doing. So we would cover, for instance, in one of the pictures, which I didn't talk about, but we cover sharps containers with CARD posters so people don't see that, and we might be preparing the needle behind the sharps container, for instance. We also arrange furniture so that the clients aren't facing the immunizer in the work area where the immunizer is preparing the doses. They might be facing the other direction. So chair facing outward rather than inward towards the table. So there's all kinds of different ways where we can try to minimize fear cues without impacting on how people would draw up the vaccines. Annie, do you want to comment on that? Is that a similar, or what do you do?
I don't think I have anything to add, but I just have to share with you a live experience again. Not only drawing up the vaccine, but the young people are getting very smart. They even go, it's up your sleeve. It's in your pocket. So just, again, it's that trust factor. I know we could hide it or whatever, but still, they are really on the mind so just to be, just play with it, go along with it, and, and I totally agree with Dr. Taddio's suggestions with the hiding, but at the same time, just to be realized the young people are very, very investigatory, very detailed with their looking.
Great, thank you. One more. All right, one more question, please.
All right. And have you found that the card system can be used to calm the parents as well if they're a little bit extra nervous during the appointment?
Absolutely. Once parents see you got their kids back, they can feel the trust too. They can feel like their kid's in good hands. So they can sort of let their kid be more independent. So we did find some parents were a little bit reluctant when kids would, in the pharmacies, for example, choose topical anesthetic as a coping intervention, because it might mean they have to wait an extra 10 minutes. But when they would see that actually that's what their child wanted, and we would support the child in that choice and say, you know what, this is a good strategy, works, we use it all the time, it's okay. We have things they can do. It's not going to make a big difference. Parents would always inevitably go along. And so our feedback is not just from the patients. When there are caregivers, we also collect information from the caregivers, and they were overwhelmingly happy with, one, just the effort. So even if, it's a little bit hard, just the fact that you tried to make it a better experience and that was more explicit, they appreciated it and they would say so.
Great. Okay, I think we are out of time for questions. We have deferred the 15-minute break, but if anybody needs a quick stretch, please feel free to do so. And our next session will be starting at 2:30. Great. Thank you very much, Anna, Annie, and Dr. Taddio. That was a great presentation.